My name is Heather Harshbarger, back office educator for Peace Health Medical Group. In this video, we will be covering the process for preparing and administration of the Pfizer BioNTech COVID-19 vaccine. First thing we're going to do is watch a video. A few things to note about the video. This was made in March of 2021. The Pfizer vaccine is now approved for adolescents 12 years and older. It has full FDA approval for 16 years and older. The Pfizer vaccine may be stored for 30 days in the refrigerator and not 5 days within the refrigerator.
In this video, we will show you how to thaw, dilute, and administer the Pfizer BioNTech COVID-19 vaccine. We will also explain how it differs from other vaccines you may currently administer. First, a few basic facts about the vaccine. The Pfizer BioNTech COVID-19 vaccine comes as a frozen suspension in a multi-dose vial, each containing 6 doses of vaccine after dilution. It is administered in 2 doses, which are given at a recommended interval of 21 to 28 days. The route of administration is an intramuscular injection in the upper arm. In clinical studies, the vaccine given in 2 doses was shown to be 95% effective across all participants, including those at risk of severe COVID-19. What is different about this vaccine compared to other routine vaccines? First of all, it has different cold chain requirements, so it must be thawed before using. The steps of preparation are slightly different, and it can currently be administered to people who are 16 years of age and older without an upper age limit. Let us first talk about how to thaw and prepare the vaccine for administration. During transport and storage, the vaccine will be kept in ultra-cold chain conditions in temperatures between -60 degrees to -90 degrees Celsius. Therefore, before being administered to vaccine recipients, the Pfizer BioNTech vaccine needs to be thawed, brought to room temperature, and then diluted. Vials may be thawed by moving them to a vaccine refrigerator, where they will be stored at temperatures between 2 to 8 degrees Celsius. At these temperatures, vials will thaw out in less than 3 hours. Once undiluted vials are in a vaccine refrigerator and kept between 2 to 8 degrees Celsius, they can stay there safely for up to 5 days. For more rapid use, vials may also be thawed for 30 minutes at room temperature up to 30 degrees Celsius. Whatever thawing method is used, you must make sure vials are at room temperature before being diluted. You may keep the undiluted vaccine at room temperature for no more than 2 hours at the most. Vials that have been thawed should never be returned to a freezer and refrozen. While the vials are in storage or in use, minimize any exposure to light. Avoid exposure to direct sun or ultraviolet light. As you can tell, this undiluted vaccine has very specific storage requirements, and it can only be unfrozen for a limited amount of time. That is why it is so important that you plan ahead carefully for its use so you can avoid any wastage. Only take it out of cold storage if you plan to dilute the vaccine within 2 hours, and only remove the number of vials you will need for the vaccination session. When the vaccine has reached room temperature and the vial is not cold to the touch, it is ready to be diluted. First, invert the vial 10 times gently to mix it. Do not shake the vial to avoid any foaming. Next, dilute the vaccine. Using a 3 or 5 milliliter syringe, carefully draw up 1.8 milliliter of the diluent, sterile, preservative-free 0.9% sodium chloride. This is the only diluent that should be used with the vaccine. Look carefully at the syringe graduation marks to verify that the correct volume is withdrawn. Add the diluent to the vaccine. Before removing the needle from the vial, equalize the pressure inside the vial by withdrawing 1.8 milliliter of air into the empty diluent syringe. Dispose of mixing syringe and diluent vial with remaining diluent immediately. Never use the same diluent vial for the preparation of the next vaccine vial. Now, gently invert the diluted vaccine 10 times. Do not shake the vial so that the vaccine would not foam. The diluted vaccine should appear as an off-white solution with no particulates visible. If you see particulates or if the vaccine is discolored, you should discard the vial. After diluting the vaccine, write the day's date and time directly on the vial. You should use the diluted Pfizer-BioNTech vaccine within 6 hours after diluting or at the end of the vaccination session, whatever comes first. Recording the time of dilution on the vial will be important to help you keep track of whether the vaccine can be used safely. After 6 hours has passed, you must discard any unused vaccine in the vial. To administer vaccine, draw up a 0.3 milliliter dose of the diluted vaccine into an auto-disable syringe. If you need to make any adjustment to remove air bubbles, do so while keeping the needle in the vial to avoid wasting any of the vaccine. Use an intramuscular injection technique to administer the vaccine into the upper arm of the recipient. Follow safe injection practices to avoid any needle stick injuries. Dispose of used syringes and empty vials in a safety box. To ensure the vaccine recipient's safety, ask them to sit nearby for observation for 15 minutes after the injection or for 30 minutes if they have ever had any allergic reactions in the past. You should now know how to thaw, dilute and administer the Pfizer-BioNTech COVID-19 vaccine and understand how it differs from other routine immunizations.
As a reminder, this video is slightly out of date. It was made in March of 2021. The Pfizer vaccine is currently FDA approved for patients 16 and older, but has emergency use authorization for adolescents 12 and older. In the past, the vaccine had been stored for 5 days in the refrigerator. Now it may be stored for up to 30 days in the refrigerator. Now we are going to review some information about vaccine administration specific to the Pfizer-BioNTech COVID-19 vaccine. Make sure that you're wearing the appropriate PPE when you're administering COVID vaccine, including gloves, eye protection, and a face mask. Before administering the vaccine, review the patient's COVID-19 vaccination history. Always screen patients for contraindications and precautions before administering a vaccine, even if the same vaccine was administered previously. A patient's health status or recommendations for contraindications and precautions may have changed since the last dose was given. Give the patient the EUA fact sheet for recipients and caregivers before each dose. Scheduling doses. The Pfizer-BioNTech COVID-19 vaccine is given with an interval of 21 days. So the first dose and then 21 days later, we will give the second dose. Third dose may be given at least 28 days after the second dose, but this is only for patients who are immunocompromised, and we must have a clinician order to give the vaccine. When do you use the 4-day grace period? The 4-day grace period is the 4-day period before the minimum interval for which vaccination can be considered valid. Do schedule appointments according to the recommended interval. So for the Pfizer vaccine, it's 21 days. Do use the 4-day grace period to determine valid doses only when retrospectively reviewing records. count doses as valid if inadvertently administered within a grace period of 4 days or less, 17 through 21 days after the first dose. Those doses do not need to be repeated. Consider doses as vaccine administration errors if administered before the grace period, 16 days or less after the first dose. These doses do not need to be repeated but must be reported to VAERS. Do not use the 4-day grace period to schedule appointments. Do not schedule appointments for the second dose earlier than the recommended day 21. The COVID Pfizer vaccine is administered in the deltoid just as other immunizations are given. Shoulder injury related to vaccine administration is sometimes reported following administration of vaccine in the deltoid muscle. Shoulder injury related to vaccine administration occurs when the needle passes over or through the deltoid muscle and is injected into or too close to non-muscular structure in the shoulder. The risk of shoulder injury related to vaccine administration is reduced by proper injection technique, including site identification and using the appropriate needle length. In some cases, our clinics will have a 1.5-inch needle length to administer the vaccine. Be sure that you are not putting that needle all the way in if the patient wouldn't normally require a 1.5-inch needle length. Adverse reactions and events. The most common adverse reactions reported after vaccination are pain at the injection site, fatigue, headache, muscle pain, chills, joint pain, fever, injection site swelling, and injection site redness. Severe allergic reactions have been reported. Adverse reactions associated with vaccination, some of which may be serious and unanticipated, were not seen in clinical trials, but may become apparent with widespread use. Patients receiving the COVID vaccine made by Pfizer will be observed for at least 15 minutes. Any patient with a history of immediate allergic reaction of any severity to a vaccine or injectable therapy, contraindication to Janssen COVID-19 vaccine who received Pfizer BioNTech vaccine, or a history of anaphylaxis due to any cause will receive 30 minutes of observation. Clinics administering any COVID-19 vaccine will need to complete an anaphylactic mock emergency in the clinic prior to administering the vaccine. This document you see on your screen for medical management of vaccine reactions in adults in a community setting should be posted available in clinics. All clinics administering the COVID-19 vaccine will need to have either maximizing doses of Pfizer BioNTech COVID-19 vaccine, or if administering Moderna, the one for administering Moderna, posted in the med prep area. It talks about different items like how many times to invert the vial, how much sodium chloride needs to go into the vial to be reconstituted, how much air to pull out. And for those caregivers who are only administering the vaccine and maybe drawing up their own dose, it talks about how much air to put into the vial prior to pulling up a dose of COVID-19 vaccine. To ensure all clinics and caregivers have access to important information about the COVID-19 vaccines, the CDC has created a quick reference guide for healthcare professionals. It talks about general information, storage and handling information about who the vaccine is approved for, the dosage, needle gauge and length for the vaccine, the route of administration, any information about thawing or preparing the vaccine, and contraindications to giving the patient the vaccine. also talks about post-vaccination observation. This may be a helpful document to have posted in med prep areas in the clinic so that caregivers have easy access to all of the information they need to serve our patients. And lastly, the CDC has created a COVID-19 vaccine competency assessment form that we will be using to ensure all of our caregivers in the clinics administering the COVID-19 vaccine are competent to do so. Clinic champions will be signed off by PHMG education on preparation and administering of the vaccine. Then they will sign off caregivers to ensure all of our caregivers have the skills needed and have a good understanding of the COVID-19 vaccine that they will be administering. If you have any questions about administering the COVID-19 vaccine or this video, please reach out to PHMG Education. Thank you.